So hello and welcome to our community reach out for Reachout. We are here today to raise awareness about the critical need to save regional hospitals, protect quality services, preserve good union jobs, and ensure community voices are heard. My name is Corinne Chinficki. I'm an occupational therapist at Regional Hospital. I started my career at Moses Taylor 30 years ago. This hospital means everything to me. I feel like I was raised here. I was just a little girl when I started coming here. My grandparents came here for all their care. I remember coming to visit them when they were sick. My aunt was head of the IV team at Moses, and I would go with her on payday to pick up her paychecks. I remember walking in the halls and visiting with the nurses and all the doctors. This is where I met my husband. This is where I had my 3 children. This is where I made lifelong friendships. So I feel like this hospital is part of me. And I know this is true for so many of my fellow coworkers. Regional is foundational to who we are, and is essential for the health and the economy of everyone throughout Scranton and Northeast Pennsylvania. The neonatal intensive care unit is a prime example of the unique and essential role, regional plays for our entire area. Our hospital has the only level 3 intensive care unit for newborns in the county. The next closest NICU is 45 minutes away. We also deliver critical cardiac and stroke care. Whether you're having a baby that's in need of intensive care or you're having a heart attack or stroke, you don't have a single second to waste. So we need to keep those services, the critical services here in Scranton. It's a matter of life and death. Seconds save lives. Our population is older, sicker, and needs more complex care than ever before in our history. Regional has over 381,000 patient visits a year, and if our hospital closed or services were cut, surrounding hospitals would not be able to absorb those patients. Any job losses at Regional would be devastating for working people in Northeast Pennsylvania. There are more than 1,000 jobs at our hospital, contributing $148 million in wages and benefits to local working families. For me personally, all of my 3 children are on my health insurance. My 2 boys are in sports, and it seems like they've broken almost every bone that you can think of over the years. If we lost the health insurance in our union contract, it would be a major health and financial crisis for our family. But having union contract standards also goes beyond supporting workers. Union standards recruit and retain workers to provide quality care. A union voice also empowers us with a seat at the table to advocate effectively for our patients. And through our union, we fight for hospital funding at the state and national levels. So any new owner must commit to honoring our current union contract and investing in maintaining and expanding medical services right here in our community. We have persevered through the nerve-wracking stress of the past year because we're dedicated to staying by our patients' sides. Now we call on all the stakeholders to stand by our sides, including hospital leaders and elected officials at every level. Do everything in your power to get a deal done.
that the people behind me are still here, keeping the doors open, taking care of those patients. We talk about the types of services, the time that matters when you're in a crisis. And the regional hospital is some place that it is essential that we make sure that we do this work to keep the doors open for the patients that come into this area and make sure we have places for them to go. You know, we've been doing this for 1 year. It is almost a year to the day that we had some sort of hope that we would keep the doors open with another buyer. Healthcare is hard. Reimbursements are low here. Compassion and the people behind me, it's at a level that I don't like when I hear it. There's low morale because what we do here is healthcare, and as a registered nurse myself, it's a calling. And when you go to take care of patients and you want to feel like you're doing the best for them, you have the best resources and the best place for them to be taken care of. And we're not doing a good job at that right now. We have to do better. And that's why the people that I get to work with, I'm an advocate now. I get to advocate for all of you who advocate for our patients. We have a really unique team of people that we get to work with here. Our Mayor Paige Cognetti, the representatives that I get to work with, our state senator, and the governor's team. The governor's team is well aware, and the administration is well aware. There's lots of crisis here in Commonwealth of Pennsylvania with hospitals closing. You hear it all the time. Rural health, patients can't get to see their doctors. We have telemedicine. Telemedicine is great, but not when you're in a crisis, and not when you have to be in the ER, not when you have to be admitted, and not when you need bedside care. And that's what we do here at Regional. We've been doing it for a really long time. And again, we have a unique environment here at Scranton, Pennsylvania, that we have generations of people that get to work together. And that's what I get to do in Harrisburg with Representative Kyle Donahue, Representative Kyle Mullins, Representative Jimmy Haddock. We are laser focused on this. They've all been schooled up on medicine and care and reimbursement rates, and it's all parallel issues that we're all trying to take care of. But you're worth it. The people behind me are worth it. I am incredibly proud to be able to go and advocate on their behalf. Again, Scranton is unique. The workers behind me are unique, but they are the definition of dedication and care. We are going to get this place we are going to do our best to make sure that the patients here in Scranton, Pennsylvania have regional hospital to go to be cared for like they have for generations in the past. It's a pleasure to do this on behalf of the people behind me that are so dedicated. I am going to introduce now another tireless colleague of mine, and I don't know which one it is because I have lots of them. So is it my friend over here? Alicia is an unbelievable organizer. Again, lucky to have her here in Northeastern Pennsylvania. And when she calls, we say yes. What do you need? So thank you very much for being here.
Good morning, everyone. My name is Alicia Hoffman-Miralovich, and I'm the Executive Director of Action Together NEPA. I'm here today to show our support for Regional Hospital, SEIU Healthcare PA, and healthcare workers. I'm here today because we all need healthcare. Our families and neighbors desperately need access to the care that they deserve. The care provided by the amazing healthcare workers standing with us today, and so many more who work at Regional Hospital. And yet, every time we turn around, there's a new threat to healthcare in our communities, a new threat to our friends and family who need care, as our NEPA population is growing older, sicker, and needs more care than ever. Whether it's Medicaid cuts to give tax breaks to the rich, urban and rural hospitals facing reduced services and closing altogether, our areas have already
accident, that the people that were injured in that accident can get the care immediately right down the street. We just can't have it. That's why Bridget and Kyle and everyone has been working so hard to help advocate, but without the people behind us, without you guys staying in your jobs through thick and thin, even though it has been so gut-wrenching these years, we wouldn't be here without you, and we are going to continue to fight and ask questions. We're going to continue to ask questions about this potential sale, make sure that if it does go through, which we certainly hope it does, that not only are they going to keep it going where it is at, but they're going to reinvest in what needs to be reinvested, because we know that there's a lot more money and a lot more help and resources and personnel and services that need to come back to let you guys do your jobs the best you can. So we're going to keep fighting, we're going to keep pushing, but it's so important that we continue to talk about this so everyone out there knows a couple things. One, that Regional is open. Regional is absolutely open for business. It is a place to go get care. It's a place to go have your baby. If you are having an issue, you need to go to Regional, but also that we're fighting to make sure that we continue to have that great care in Scranton. So thank you especially to everyone that is still walking in every day to keep us safe and healthy. Thank you. And I'm kicking it to somebody. Thank you, Sue.
Hello, everyone. My name is Sue Wiggins, and I've been a medical lab tech for over 40 years, the last 7 of which I've worked at Regional Hospital. I've been in the medical field all these decades because I believe strongly in contributing to the health and well-being of my community. That's why I'm out here today. I want to make sure our hospitals save, along with the services and good union jobs that are so vital to everyone in our area. I want to point out a few more of the ways that Northeast Pennsylvania would be unable to meet the demand for healthcare services if there were cuts at Regional. Regional handles 36,000 emergency patient visits a year, which would have to be absorbed by other ERs in our area. But all other ERs in our Lackawanna and Luzerne counties already have long wait times. Any cuts to Regional's ER would worsen this growing crisis. Regional also delivers over 1,700 babies a year, 70% of the births in Lackawanna County, and other area hospitals cannot accommodate this additional patient load. The need for a full range of quality healthcare services is only going to grow as our population ages and struggles with chronic disease. Having our union enables us to advocate for the kinds of standards that recruit and retain staff to meet those patient needs. Through our union, we also advocate for the safest, highest quality care. So I'm here to call on Tenor or any new owner to respect our union and our union contract and invest in preserving and expanding the services that will meet our community's growing healthcare needs. Let's work together for the success of our hospital moving forward. Thank you.
Thank you, Sue. Now I would like to introduce Kyle Mullins, our state representative. He's been a great champion for our hospital.
Thank you so much. Good morning, everyone, and sorry for being a few minutes late. I was actually waiting on a plumber to come fix our heat. But more importantly, we've been waiting for answers on this hospital for far too long. Right? You know, when you go to a hospital, it's a very uncertain time. No two pregnancies are the same. No two surgeries are the same. No two patients are the same. That